Juneteenth. It's a holiday often called the Black 4th of July. It's celebrated with cookouts, festivals, historical reenactments, and it's one of the most important days in African American history. Juneteenth celebrates the end of slavery in the United States. You see, the U.S. Declaration of Independence stated that all men were created equal, but this didn't apply to black slaves. The move to end slavery didn't happen until Abraham Lincoln issued a law in 1863, almost 100 years later. But the news took more than 2 years to reach all parts of the country. The state of Texas was the last to find out. On June 19, 1865, 250,000 slaves were freed in Texas, marking independence for all Americans.
What's your new TV network you're going to be watching?
Pic TV.
There you go. Hey everybody, this is Dr. David Evans. I want to thank you for coming in one more time to the Pic TV Network Healthcare channel. We want to thank you for watching with us today. We're also happy to beam this presentation all the way down to Atlanta, Georgia. One of my favorite persons in the world, that's Coach Jean Turner. I'm so happy for Jean being with us once again. She is our business manager in the Pic TV Network and also Atlanta, and she's also in the healthcare business. How you doing today, Jean?
I'm wonderful, Dr. Evans. Thank you for inviting me on the news channel on this segment. Doing well. It was a great day. No complaints.
We're always happy to see you. We want to also welcome our guests coming in from Canada, Mexico, France, Germany, Africa, Peru, Chile, Korea, Japan, Brazil, Colombia, Panama, Ireland, United Kingdom, Argentina, United States, and the rest of the world. Jean, let's get into it. Let's get right into it. You know, today, earlier, you had me on your radio show talking about the healthcare crisis and how important it is to have healthcare today. And caretakers, there you go, the caregivers. Jean, what sparked that subject to come up and why you felt that was important to talk about today?
Well, what sparked the subject really occurred 3 years ago. So when I had a suddenly health crisis and my husband became my caretaker, and it dawned on me even then that so much emphasis is placed on the person who is dealing with the physical affliction, the prayers and, how they doing and things of this nature. But the caregiver does not seem to get the same type of attention. Very seldom does someone ask the caregiver, well, how are you doing? Is there anything I can do for you? Because their concern is mostly on the one who is afflicted. And why now? So my question to that would be, why not now? especially now during COVID-19. We're almost 2 years into this pandemic. We have seen a lot of deaths within the United States and around the world. And more and more people have become caregivers of their loved ones, of those in their households who have been infected with the virus, with the COVID-19 virus. So now is just as good as time as any to bring up and have these discussions and draw attention to the caregiver and the caregiver's needs, and how the illness, as well as what they do as far as their task goes, how that affects their overall health and well-being.
Yeah, that's important, Gene. When we look about the healthcare today, it's very serious about how do we take care of the elderly? How do we take care of the sick? How do we take care of those in need today?
Mm-hmm.
And you're talking about bathing people and cooking for them and cleaning for them, going to doctor's appointments for them. We talked about this earlier, and my mother and father Evans, before they passed away, we had to take care of them. I didn't want to put my mother in the nursing home. I didn't want to put my father in the nursing home. So all of us, Kenny, Junior, Darlene, Esther, Elaine, Edie, all 9 of us, Brenda, everybody came to rally together. How we gonna take care of mom and pops, And my mother passed away first in '97, and my father passed away a year after that. They had been married for 50 years.
Wow.
So yeah, we had to go through Dad going through Alzheimer's, and my mom. I never thought my mom would leave this earth. I'm a baby's boy, and I remember going praying for my mom at Providence Hospital, and I remember when she was going to the hospital, they called me and said, "Rush down here," and I rushed down there and went to my mother's home, and they was taking her out, and it was so sad because of the fact my mother didn't have a chance to come back home. When they took her out, she didn't come back home, and we all had to take care of her. And being a caregiver and a caretaker for a person is a lot of responsibility, because it's just like our parents raised us. Now it's our time to take care of them, and it's so important for us not to forget, Gene, to give back.
I agree. And when you consider now that, and this is the reason why those of us at our ages are called the sandwich generation, right? Because we are married, we probably have kids, and even if our kids are grown, they're still our kids. They just have a different set of issues, right, that they come to us with, right? But, we're sandwiched between, many of us, my parents are deceased now, but there was a time I was sandwiched between my parents and my children, my sons, when they were growing up. My mom got sick and we had to move her down from New York City down to, we were stationed at Fort Stewart, Georgia at the time. And we had to move her down, and care for her during those 3 years until she was able to get back up on her feet. And at the time, my boys were teenagers. So I was dealing with teenage boys and then trying to take care of my mom and working and a husband and different other things. So that's why we're also known as the sandwich generation, because you're trying to divide your time between spouse, children, maybe even grandchildren, and taking care, whether it be your elderly parents or probably even a child who has a chronic illness or disease, but you're caregiver and, just trying to just live life and go about your normal and daily activities.
Yeah, Gene, it's so important for us on the Pic TV network to talk about this. It's a serious subject. There's millions and millions of people who work in the caregivers business, taking
Right.
care of people 24/7. Some people need that 24/7 care. And it can be a burden on a person if they try to do everything by themselves, Gene. We talked about this today on your radio show. And let me pause to say congratulations on your new book. Hey,
Thank you.
I got a copy because it's going to be the hottest thing out there. So I hope you got a copy to flash up there, so people can get your book too. Those that you're watching the Pic TV Network Healthcare talk show, our brand new talk show with Coach Gene, Turner. She is from Atlanta, Georgia. I'm from Washington, D.C., and she is our representative there in Atlanta. And also, she has her own radio show. I was on her show earlier today, and we talked for an hour. People were calling in from California. They called in from Ohio to New York. And it was an amazing subject. And I wanted to bring that to the television audience tonight. It's important to be caregivers and not forget those, Gene, who need our help. And you asked me a powerful question this morning. What is the word that I can say that will that people will remember? And I say love. Mm-hmm. Greatest medicine is love. The greatest therapy is love. The greatest help is love. And that's what we always have to remember. I see Michelle Cox just joined us too. She's down in the bottom. We're going to bring her up in a minute.
All right.
A little bit.
All right. Yeah. Look, the greatest gift, like you said, and I was so glad that your final takeaway for the audience earlier today was love, because God is love. And that's the greatest gift that we can give anybody. But as a caregiver, whether you're a caregiver for a loved one, whether you're in the medical profession, the healthcare profession, as myself, like I am, if you are not in it because of your love for people and are unable to selflessly care for somebody at their most vulnerable time, because sickness, I think, is the most vulnerable time in our lives. And if you cannot demonstrate that love and give that loving care or just a loving touch, right? Then what are you doing? Why are you doing it? And so, yes, that question and your answer, Dr. Evans, was so powerful, because it has to be done in love. That's the only way you are not really caring or giving care to someone unless you have love either for that person or that agape love, that love for all of mankind. You're not giving care. You're in it either because it's a dollar, it's money, it's a steady income, a steady job, or whatever. But yes, there must be love. And so I totally concur. I love that answer you gave earlier today as a key takeaway, that one key takeaway for the audience earlier today. And I you know what? I hope that's the key takeaway even from our show right now. Love.
Yeah, I'm also happy to have Michelle to come in. Michelle Cox, she is my right hand. She is another Atlanta. I don't know what's up with all these Atlanta people coming on. I'm from D.C., y'all. We the world-class city in the world. This is where it pop off in D.C., but Atlanta got it going on. Michelle, I was on the broadcast this day with Coach Gene, and we was talking about caregivers. And I know you know about that, being a family person, how important it is to care for those. We talked about this in Reconnecting the Generation. Michelle, talk a little bit about, Michelle, how you feel when it talks about caregivers.
Well, my mom was a nurse, and I was named after my great aunt Leanna, who was a nurse midwife. So that runs in my background. My mother wanted me to be a nurse. Unfortunately for me and everyone else is, number one, I don't have that great a bedside manner. Number two, when bones or eyes are out of socket, I can't keep my composure. So I would let someone else that has that strength do that. Now, I've given care. I work for the Job Corps program. I've done first aid on busted heads and things like that. When you have children, you got scraped knees and all that other stuff. So instinctively, we have that care. I love children. I love babies especially. And so that's where my love comes. That's one of the reasons I write books for kids, because that is where I express my love. But I'll tell you about my instance in the healthcare, because here in Atlanta, I broke my hip in 2019. And so I had to be rushed to the hospital for an emergency surgery. And the doctors and the nurses all were so caring for someone like me. And then I see all their patients. The other part of it is I'm also dealing with breast cancer and sarcoidosis. So there's some other things that have to come into play when we talk about getting the health care or the care that we need. And so the care you get a lot of times depends on the attitude you give. Because for me, I always make sure that even in my moments of pain or unpleasantness, I know that number one, they're a human being just like me. They have feelings. Nurses and doctors have feelings just like me. And that I need to make sure that I use care when I get care, because that also determines how people respond to you. If you're a good patient, you get better care. Not that bad patients don't get good care, but the thing about it is when you're a patient and you aren't living in gratitude, you drain the people that try to serve you. And that's one of the things that you have to take into account, that we have to make sure that we take care of each other. And so even as a patient, even if you're going through, try to smile. Even if you're going through, have words of kindness for the people that help take care of you. You'll see the difference in the care that you give. Jean, what do you think? Back
Oh
to
no, I love that. I mean, I think you're spot on, Michelle. And look, the realization, I'm so glad you said that, because the realization in today's healthcare system is everybody is overworked. There are nursing shortages, doctor shortages, working 15, 20 hours on call every other night, especially now during this pandemic. Okay. So healthcare professionals are already burnt out, tired, but still trying to give the best care they can give. So your attitude, even though now going through a health crisis a few weeks ago, I understand now all the other dynamics that comes into that, but yet and still there is always something to still be grateful for, and you can still display some semblance of kindness to your healthcare team, because there's a lot that goes on behind the scenes that patients do not know, and we will not let you know, because we want to give you the best care that we can possibly give you.
That's amazing. We're going to take a break. I want Patty to come in from New York. Patty is just angel in disguise. Patty, we were talking earlier, and I wanted you to talk a little bit about healthcare and your moms. We've been praying with moms. She's been home. She's been in and out of the hospital. But to care for her, I believe the best medicine is you, Patty. The best care is you. The best therapy is you. When your mom sees you, she don't know a lot of those people. She longs for your touch. That gives her new life. That gives her inspiration. That gives her encouragement. Patty, talk about that a little bit. How do you feel when you come and see your mom, even in?
Well, thank you, Dr. Evans. I appreciate that. So my mother, she wants to die working. First of all, let me just get that straight. But she is in her mid 70s. Sorry, Mom, I'm going to say that. Everybody knows I'm 50, so come on, do the math, But anyway, the point is that literally when she ended up getting ill with internal medicine, it took a toll on her. A lot of things are accountable, her age, her prior histories, but nobody really saw that coming. And, it was just one of those things that you just had to go into autopilot. I wasn't prepared to have to be the caretaker, and it's only me and my sister, so, and my sister is a businesswoman. We have the family business, so between trying to keep the business going on both ends and then being the caretaker, and my dad also, but nobody prepared us for that. And so that was a monkey wrench, but then you go into autopilot. But then because it was such a long experience, unfortunately, it really she's really not even out of the woods yet. Sorry to say it. She's like 90% better. But you definitely see the toll it took. But it was the whole entire summer, because it was emergency surgeries, and I'm not going to get into the details of it. But it took a toll on us because it was like only a couple of us that were able to really be the caretaker. And my mother was really wanting to give us the relief and saying, don't leave me alone. It's okay. Go take care of your family. It's like she was being the mom hat, right? She was wearing the mom hat, but then I was wearing the, like, I got to do the right thing hat. And it was really like a struggle. I got to be honest. Like, you give me too much credit, Dr. Evans. Like, there were times that my mom was like, you know what, just there's nothing you could do. I'm fine. And she was not fine, but she was saying that. And I knew she was just saying that so I could like kind of replenish myself, because she knew it was taking not only like a physical strain, because then you become tired and kind of like, you're trying to do it all, and at the same time, you want to be there for your loved one. So my mother was being a mom, and then I was taking advantage of her being my mom. But then I also was like, okay, you got to put my stuff to the side. And it was a struggle. So, I really have this other compassion. Like, I've seen friends take care of people for long term. I gotta tell you, I have a lot of compassion for people that are caretakers. It's not easy. And now I'm in the process of becoming a certified end of life coach. And I'm just learning different perspectives. And listen, I'm human. I'm just gonna put it out there. It's not easy. It really, really sucks you in. But these people, like, I remember my mom couldn't see visitors until 12 o'clock. And even though she would tell me she's fine, I knew she was counting the minutes to see me. So it's just this, like, yeah, Michelle knows. Jean knows what I'm talking about. It's a struggle, and it's trying to find that balance. And that's why I love Jean's topic today. I saw your radio show. That was great, Jean. Balance. And I'm excited about your book. Woo, woo, woo.
Thank you. Now, but you said something very key, because especially when our parents become a certain age, elderly, that routine, they get into that routine. There's certain people that they're used to being around them and knowing what their need is. So then when you take them out of their environment, what's familiar, what's comfortable to them, right? And they have to go into the hospital or some kind of other facility, then yes, they crave that familiar person, that familiar face, some of that routine. So yeah, I know the clock was ticking. Your mom was probably looking at the clock like, where's she at? Like, just counting the minutes. But I mean, that's just part of the routine for them. You know how it is. You get, well, okay. I'm 58, so I'm beginning to understand it more. I got my routine and I'm sticking to it. So yeah, but it plays a role into their whole emotional and mental aspect of it, which Dr. Evans, we talked about that earlier too, because there's emotional and mental, psychological aspect to the care, and a spiritual aspect to being a caregiver, is it not?
It is. It's a lot of responsibility. I watched my wife take care of my mother-in-law, Mother Edwards, who's 87 years old. And when my wife's mom got sick, her life changed, and I had to make an adjustment, because she was talking to her mom 3 o'clock in the morning. Her mom would say, "I need to go to the doctor." She had to take her to the doctor. She had to stop her work schedule. Her mom fell a couple of times. She was living by herself, so she had to go see her, and I had to make that adjustment to be there for my wife, because to take the stress off of her, and to see how her mother, when she was here, needed to go to the doctors, needed to take her medicine, needed to get fed. My wife literally, Michelle, had to go live with her mom a couple of nights. And I was like, who's going to take care of me? Who's going to take care of me? Who's going to take care of Dr. Evans? So I had to make that adjustment, because, she put her mom in a position that her mom needed her. And I had to, 2 o'clock in the morning, we had to take her to the hospital. And I had to be there to pick her up, because my wife wasn't going to leave her. She's gonna be with her mom all night long. Now women going back to pick them up 5 o'clock in the morning. But a change took place because my brother in law Clifton said, I'm gonna take mom down to North Carolina. And when he did that 2 years, mom aged backwards. She's walking, she's cooking, she's talking, she got the COVID shot. She's on the internet. She's doing more than I am. She aged backwards. I don't know what happened in North Carolina, but Mother Edwards is a brand new person. Maybe it's that Southern food y'all got down there, G.
Well, I don't know about the food now, because some of this food, no. It might just be the fresher air, being in the country, less noise, less of the rat race, I like to say. Being from New York, I call it the rat race up north.
Yeah, the stress goes away. Hey, we're going to take a break, and we're going to come right back after this. We're looking, all of you chatting in, I see your chats coming in from everywhere. You're on the Pic TV network, our news, health talk, and we're here with Patty from New York. Can you wave, Patty? Our very own Michelle Cox from Atlanta, Georgia, and Coach Gene Turner. These are all of our Pic TV network managers on our team, and they're talking tonight from what's on their heart and what they feel about our healthcare crisis. We're going to be right back after this. TV network you're going to be watching?
Pic TV.
Well, my brothers and sisters, we're right back on our new segment today. Time flies. We have to close this broadcast, but we do have another broadcast coming up right after this. We're trying to let everybody know that our Pic TV network segments that we have are designed with you in mind, and those who are on the go. So before we leave this segment and go into our next segment, I want, Jean, can you tell everybody about your book? You have a brand new book out. Can you just give a shout out to her, our very own Jean, about your book, Jean?
Thank y'all so much. So my newest book is There Must Be Balance, Your Health Matters. And it is available on Amazon as an ebook and also in a paperback format. But it goes over, what is balance, work-life balance, lifestyle balance. And we also go over balance and health from a holistic perspective. Holistic meaning whole person, whole body perspective, covering the 9 domains of wellness. But yes, it's very important, especially for what we're talking about now, right? In everybody's life, whether you're a caregiver, entrepreneur, corporate America, whatever stage of life you're in, right? We juggle so many things. But an imbalance in any part of what makes us human creates disharmony and imbalance throughout our entire body. So there must be balance, and it's available on Amazon. Thank you so much for allowing me to share.
We're so proud of you, Jean. I mean, it's so many people who need that book, want that book. We got to bring you on the Pic TV Network book channel, and we're so excited for all of you who watched our show. Don't forget, we have another show coming up. right after this. So long, everybody. God bless.